Hey everybody, I'm Dr. Wayne from drwayne.com. I'm a licensed chiropractor with a specialty in clinical nutrition and spinal correction. And today I'm going to talk about the most common injuries found amongst bodybuilders. I would say that the most common injury found amongst bodybuilders is a disc injury in the neck. And probably the second most common is injury to the shoulder, particularly the rotator cuff muscles. So today I'm going to teach you how to treat those injuries as well as prevent those injuries from ever even occurring. So I'm going to teach you a little bit about the spine so you understand the importance of proper spinal hygiene and why it's so important to take care of your neck and not have one of these disc injuries even occur. So the way your neck is designed is, the job of your spine is to support your head over your shoulders, but also protect your nervous system. Your nervous system's job is to control and coordinate the function of every single part of your body. Okay, run your heart, your lungs, even contract your muscles. Now the job of your spine is to protect that nervous system. So in your neck, you have 7 little bones. And in between those bones, you have what's called intervertebral discs. Okay? These discs, they're like a shock absorber, or like a cushion. So they keep the spine bouncing, they keep it lubricated, so it can take on gravity and stress. Now here's what happens. We're designed to have a natural C-shaped curve to our neck. So from the side, we have a healthy, think of it as a banana-shaped curve. What happens is that curve in the neck starts to go straight. And when that neck goes straight, it puts all this unnecessary pressure on the joints in the spine and on the disc. And in time, what happens with that disc is it starts to swell. When the disc swells, it bulges, and if it's not treated properly, a bulging disc eventually ruptures. It's like a balloon getting too much air. And when that disc ruptures, let me tell you, you're forced to take time out of the gym. Months out of the gym for recovery. You're going to lose all of your gains, and it's a nightmare. So it's very important to understand the warning signs of a bulging disc, because most of the time, people have a bulging disc, and they really have no pain in the neck, but they have pain in other areas of the body that they never would associate to the neck. You see, here's how your neck works. You got a spinal cord that goes down through your spine, right? Then you have all of these nerves that exit your spine, and those nerves travel everywhere. Now, it's a fact that 98% of your body's function actually comes from your neck. So your neck is the most important area of your body. So think of people that are paralyzed. They break a bone in their neck, they're done. A lot of times they lose heart function, lung function, digestive function, and they can't even walk. Okay, so very, very important to notice or to recognize the warning signs. So when that disc starts to bulge in that neck and it hits that spinal cord and it pinches down on those nerves, you can get pain traveling all the way down into the fingers. So you can get sharp shooting pain, you can get buzzing pain, numbness and tingling, you can get pins and needles, you can get burning pain in your mid-back. Okay, you can feel like a rib head's out of place. After doing heavy shrugs or bench press, you can get a lot of pain in your shoulders. Okay, and you think that there's a problem with your shoulder. It's not actually a problem with your shoulder. It's the nerve. You follow the nerve, exits right at the neck. Now, what I have found over 13 years, I've worked hand in hand with a lot of bodybuilders. And what I found is, not only are bodybuilders' necks straight, they're actually going into the opposite direction. So I want you to picture, take a banana, straighten out a banana, and then kink it into the opposite direction. Where that kink is, it's usually right in the middle of the neck. It's C5 and C6. And that's where everybody that has a disc injury, that's where they're developing their issues. And now what happens, pressure over time, all that stress in that area where that kink is, that disc ruptures. So you might not have warning signs for many years, but when that disc ruptures, you're going to know it. You can also have complete loss of muscle strength. Imagine that's a nightmare for a bodybuilder, to be able to curl 5 pounds in one arm and 50 pounds in the other. How about symmetry? To have your right arm a fraction of the size of your left arm because there's a nerve so pinched in your neck because of that herniated disc. So I want to make sure that you know these warning signs to prevent you from ever going down this road. Okay? Now, what causes our neck to go straight? Well, it's very obvious that in the gym we have a lot of straining. Okay? So when the neck is straight, we're straining. Say we're doing dumbbell shrugs. All that weight. Our head is forward like this. We're pressing all this weight. I see a lot of people doing bench presses with their head forward like this. It looks silly. Also, we're doing behind the neck lat pull downs, head in this position. We're doing crunches with our head in this position. And on top of that, let's leave the gym. Look what we're doing all day long. Most people are sitting at a computer in a slouch posture. We're text messaging like this, reading books like this. Then we go home, we lay on the couch, we put a bunch of pillows underneath of our neck. So you get the idea? We are living our lives in this position. Take a look at a senior. That's why they all look like this, right? And that puts massive pressure. Think of your head's about the weight of a bowling ball. So that bowling ball, if you hold it out like this compared to close to your body, you're going to destroy back here. Okay? So, in my clinic, the way that I've treated all of these neck injuries is number one by chiropractic adjustments. And it doesn't need to be forceful. It's very specific, very gentle. And what that does is that realigns the joints. It gets that curve back into the neck. And when that curve is back into that neck, that disc starts to relax. All that inflammation and swelling in that disc just starts to go away and dissipate. Now let's think of something else. Let's think of the muscles that are connected to your spine. When your neck's in a forward position, okay, your neck is straight, those muscles, they're going nuts. They are so tight and so taut. And then we're training those muscles every single day. We are more susceptible to a sprain, strain injury. Okay? Now, you would never think that that little nerve in that neck could go down into that shoulder or go all the way down in that wrist. You guys ever hear of carpal tunnel syndrome? There's so many people that battle carpal tunnel issues. There's not even a problem here. You trace it all the way back to that neck. Okay? So I hope that a few of this information helped you to not only look into chiropractic, to help restore that curve in your neck, but also what to look for. When you're going to a chiropractor, you want to make sure they do the proper tests. Okay, or to a medical doctor, make sure that they take x-ray and they take an MRI to see exactly if you do have a disc bulge or a disc rupture, so we know exactly where to treat. Okay, so let's talk a little bit about the shoulders, rotator cuffs. So how many times you hear people, they can't bench press anymore, they can't do heavy military press, can't even do side laterals because their shoulders are shot, right? And everybody wants big shoulders, defined shoulders. Well, one of the main reasons why the rotator cuff, and what I mean by rotator cuff, there's four of them. They're called the sits muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. The job of those muscles is to stabilize your shoulder joint. Okay? Because believe it or not, the only bone that connects your arm to your body is your collarbone. The rest is all muscular attachment. So there's so much stress on that joint, the rotator cuff stabilizes it. But now picture this as a bodybuilder. You got a big chest connected to the shoulder. You got your lats. You got your deltoids. And that constant strain on the rotator cuff muscles causes them to strain and to tear. Okay, so you can have different levels and degrees of tears. Now, one of the main reasons why the rotator cuff muscle tears is because of improper warm-up. One of the worst things we can do is to stretch before we exercise. That makes you more likely and more susceptible to getting an injury. You want to make sure you stretch after your workout, not before. But you want to warm up that joint. You got to get blood going into that joint. Blood brings oxygen and nutrients for healing. So I always like to do rotator cuff exercises. You can get a dumbbell, okay? And you do high reps, lightweight, high reps. Or you get a cable. Cable's the best, or like a rubber band. And you go this way, you go up, you go in, you go out. And you do high reps. Do it on both shoulders. Okay? Then you do some side laterals, light side laterals, and I like to just take a 5-pound weight and do windmills on both arms. Then you're ready. Because most of the time, it's just not a warmed up joint and you tear the muscle. Now what happens if your muscle is torn? First off, it's terrible pain. It hurts bench pressing, shoulder pressing, side laterals, even doing biceps. What I did for treatment in my office is I did active release therapy or soft tissue trigger point release therapy. And it's extremely painful but highly effective. That's when the doctor or the therapist gets into that muscle. They find one of those sore spots and they dig around in that muscle. And it'll refer pain to different areas. It can go to your eye, your head, to the problem area itself. And it'll just relax. It'll take the tension out of that muscle. I always give the analogy of having a zit. You got this painful zit. You pop the zit, it hurts, but then it goes away. So you got all these painful zits in your muscles. They need body work. Okay? All day long we're flexing those muscles. We've got to relax them as well. Okay? Hope that helps. Now, let's talk a little bit about supplementation. Because remember, your body is designed to heal itself. And it can heal itself from most injuries. But it has to have the building blocks to heal. It has to have the material to heal. Okay, so I call these products foundational nutrition products because they're mandatory. Everybody should be on them. And this is from Now Nutrition. Okay, awesome supplement. It's omega-3 fatty acids, 6 and 9 fatty acids. So what this product does is it's a very powerful anti-inflammatory. So know that any injury in your body, whatever you're suffering from, there's inflammation at that site of injury. So you want to minimize that inflammation as much as possible. That's going to help with pain and also help with the healing response. And that's what omega-3 fatty acids do. They minimize the inflammatory response. The other thing that omega-3 fatty acids do is they're lubrication for the joints. It's oil going into these heavy weight-bearing joints. So when you're well oiled, well lubed, you're much less susceptible to injury and you just feel better. You have better range of motion. Okay? Next thing is Joint Tech from Dymatize. This product is extremely powerful. It has everything in it to heal that joint. It has glucosamine, chondroitin, hyaluronic acid. Okay? Also, I'm missing one, has MSM. That's everything. Okay? Most bodybuilders don't take this product. Okay? They're so into taking creatine, glucosamine, their whey protein, but they're forgetting their joints. And there's nothing worse than having joint pain keeping you out of the gym. Alright? So, another big mistake with bodybuilders is they don't take enough of this. Remember, you guys are big. Okay? You're not like the average 140-pound male. So you got to take a higher dosage of this to work. And also, you got to give it time to work. 1 month isn't going to do anything. You got to take this, well, I recommend you taking it forever. But you got to take it at least for 3 months to start to build that cartilage. So here's what happens. On our heavy weight-bearing joints, especially the knees, the hips, the spine, that shock absorber, that cartilage is gone. So it's bone on bone, rubbing. Causes a lot of pain, pinches nerves, puts muscles into spasm. This will repair and rebuild that cartilage, give you that shock absorber. Then we put some oil into that joint so you're better lubricated. Okay, so absolute must. Another one that's imperative is good old glutamine from Dymatize. Glutamine is so powerful because it helps strengthen your immune system. Your immune system's job is to heal your body. Okay? When your immune system is weakened, you have poor healing. But when you take glutamine, it raises your immune system. It's very good for recovery. Remember that as a bodybuilder, your muscles grow when you're recovering, not when you're training. You've torn down all your muscle fibers by lifting. Now we got to give it proper nutrition so it heals and recovers and grows. That's what it's all about, right? So this is also good for protein synthesis. Okay. Next, which we know everybody's pretty much taking a good, taking protein, but there's many different ranges of protein powder. I love the Dymatize, and the reason why the Dymatize ISO 100 is because it's packed with digestive enzymes. Okay, for a lot of you that don't really know what digestive enzymes are, digestive enzymes, that's what absorbs all of the nutrients from your food and goes into your bloodstream and goes to the joints and everywhere it needs to go anyways. So when you're taking a protein powder without digestive enzymes, it just sits in your colon. It rots, it putrefies, it ferments, and it causes gas. And your girlfriends can tell you a lot about that. So it's important to take a good quality protein powder that has digestive enzymes, because after the age of 20, our own natural digestive enzymes go down. 40 or 50 pretty much aren't producing any. So really good. Okay, so I hope that helps you a lot. Some good, powerful information for you. Next video series, we can talk about low back injuries, bulging discs in the low back. That's an epidemic. Also knee issues and hip issues. Okay, and also some more supplementation as well. Once again, if you want to find any more information about me, it's at docwayne.com, and I am a nutritional coach. So I have electronic books that I sell on weight loss, on hormone balancing, and on proper lifestyle modification programs. So that's it. I hope you got some good information from this, and I'll talk to you later. Goodbye.